Melissa Pinkston. I'm one of the physical therapists and clinical specialists that works with Aspen. And we are here with our former patient who just wrapped up her treatment. This is Melissa. Melissa was seen and doing our fast track where she flew in, stayed with us, and did 10 treatments over the course of 5 days. Today we did her 30-day review to check in on her and see how she's doing. And as she'll tell you, she continued to make progress from the last time we saw her until now. So Melissa's history is she had a breast augmentation at the beginning of this year and was doing okay, but started having sharp pain in the left breast. And we're contributing it to the only real trigger that we found is that she was doing a high intensity workout, felt a strain, and then the breast continued to get firmer and higher. And Melissa, why don't you tell everybody how you found us and just kind of your journey of getting here?
Yes, as you said, I was released to do my workouts. I did everything I should have done. I thought everything was fine. I would say around 3 or 4 months, I went through my final follow-up with my surgeon. Everything looked great. He released me to do my workouts around 6 weeks in, but I tried to go in pretty slowly. I did, for me personally, felt like I wasn't quite ready, but I was still trying to kind of ease into it. But I did notice, after some time, I was like, okay, I'm feeling a bit more comfortable, but anything push-up wise, burpees, I was definitely, at 100% and at the beginning around 0. So it took me a while to kind of get there. But at some point I did feel comfortable. I did a particular workout where there was a lot of burpees involved. And then afterwards I did feel like, oh, did I go a bit too far? And then at that point I did feel some stiffness. I just felt like the breast stayed in that position. And then also during that time at night, I felt some, if I was sleeping on the breast, some pain. I would wake up in the middle of the night, some tingling sensations. I looked online, and since I'm pretty early, I felt like it was pretty normal. But over a course of a few weeks, I felt like my right breast dropped a lot faster than my left, and the left just continued to, get harder. And then at some point I did start seeing the shift visibly in the mirror. And then that's when I knew something was wrong. I, used Google, tried to Google my symptoms. And that's when I found more of, all the symptoms for capsular contracture. I felt like I had every single one on the list. I contacted my surgeon, and then at that point they suggested for me to come back and see them, and they felt like I had it as well. So at that point I just started doing my research. I knew I didn't want to have surgery again, so I just looked tirelessly everywhere to see if there was another option, and that's where I found Aspen.
And any thing you can tell people watching this, if they're contemplating surgery or coming to Aspen doing a conservative treatment?
First I do suggest to get your surgeon's recommendation, but you should advocate for yourself as well. Come in with the right mind. It's, this is an option that could work for you, or, you may have to have surgery afterwards. But if you come in with a good mindset, understanding, okay, this is a potential option for me to avoid surgery. And I think this is great for people. Online, there's wonderful before and after pictures that will certainly help. But yeah, I think for me, I just didn't want to go into surgery again. I just wanted to have another option because surgery was not easy to go through. So I was just open to any options that, that would come my way.
And overall, like if you had to rate your overall improvement, like 0 to 100% in softness, positioning, all of that combined, what would you say like your overall improvement from the first day that we started with you?
Overall improvement, I would say probably 70% with softness, position, all of that together. So major thing for me was just the pain. I'm not waking up in the middle of the night feeling stiff or feeling like something's on my chest. So I'm very happy with that.
Okay, perfect. Anything else you want to share about your experiences, things they can expect when they're here?
Um, all the therapists are wonderful. They help answer all the questions. I'm very thankful for that I had the opportunity to go out to Aspen and seek treatment. Again, there's other options versus surgery. Not everybody's going to get 100%, but if you have the time and the means to make it out there, I certainly recommend it. Also, for me, I had to have a lift, so I had a lot of scarring, and the therapist there certainly helped with scar treatments as well. So that was one other thing, is that I wasn't doing any treatments at home for that, so they helped teach me those exercises as well. So I mean, overall, I just feel a lot better.
Great. Thank you so much, Melissa. If you have any questions, we do video consults to make sure that patients are a good candidate before they come out for treatment. So please, at the number shown, give us a call. We'd be glad to help you. And just like Melissa said, we take the approach where we look at everything going on. So yes, you could have a capsular contracture, and we work on lengthening that capsule to improve the softness and positioning. But we also look at other things like, do you have muscle imbalance where you have pec tightness and that's contributing? Do you have scar tissue from a lift or just from the surgical, incision? And we look at that and address those issues as well. So we do look at everything going on to give you the best possible outcome. So thanks again for sharing, Melissa.
Of course, thank you.
All right.